everyone, welcome to the course on medical biomaterials. We will continue on the topic of biopolymers, mainly proteins, and we will then transform to another important biomaterial that is called hydrogels. Okay, so we were talking about in the previous class about proteins. What are these proteins? They are the condensation polymers made from amino acids and polyamide. So obviously they have the peptide bond or the amide bond, that is C double bond O N. There is a reaction when you have between NH2 and COOH, that is the acid, you end up having this particular peptide bonds. So in nature we have proteins found in abundance and they can be used as a biomaterial, okay, like skin, organs, muscles, hair, fingernails. So a lot of biomaterials, protein based biomaterials are found. For example, your collagen, keratin, silk, elastin, all these are different types of protein based biomaterials. In the previous class we talked about this collagen. Okay, collagen is most abundantly found protein in the body. It has got a triple helix structure, so it has got 2 alpha 1, in between you have a slightly different alpha 2, it forms a triple helix. Okay, it can get denatured and they get separated out, and if there is an enzyme they can get degraded into smaller peptides. Okay, there are 28 collagen types that are found. The type 1, 2, 3 is found 80% of all collagens within the body, and so it is found in bone, cartilage, tendons, skin, muscles. It is composed, as I said, of triple helix like this, alpha 1 chain and alpha 2. Okay, alpha 2 is slightly different in chemical composition. So a lot of applications, it is used in vascular. So already there is a commercial product in vascular prosthesis, collagen polyester composites used for peripheral arterial reconstruction. It has got very good structural durability, long term patency, low infection rates. Then it can be used as adhesion barrier membranes. So we can reduce internal scarring following surgery by separating the internal tissues and organs during healing. It has got good handling properties. It can be contoured to the tissue. Okay, that is the beauty of it. Collagen shields, so we can have bandage, contact lenses which gradually dissolve in the cornea. Mechanical properties of the shield protect the healing corneal epithelium from the blinking action of the eyelids. It can be used for delivering drugs. It lubricates the surface of the eye, increases the contact time between drugs and cornea, increases epithelial healing. Then comes collagen sponges. It is very good for severe burns, used as a dressing for any type of wounds. It can absorb large quantities of tissue exudates, smoothly adheres to the wet wound bed, shields against mechanical harm, secondary bacterial infection. It can be used for delivery of steroids, for example intravaginal delivery of lipophilic compounds like retinoic acid for patients with the cervical dysplasia. Okay. Then comes collagen gels. It can be flowable or injectable drug delivery system for ophthalmic use. Initially it is in the form of a liquid which turn to gel after administration to the eye. It can be used for sustained delivery of non-steroidal anti-inflammatory drugs for inflammation, pain, joints, or even antibiotics. Okay. Then atelocollagen gels used as a carrier for chondrocytes to repair cartilage defects. So it is quite widely used because the cartilages contain primarily collagen, hence it is used repair of such. Then it can be made into pellets or tablets, mini pellets small enough to be injected into the subcutaneous space through a syringe needle. Prolonged retention of large molecular weight of drugs and decreased maximal concentration in the serum. So such administrations are also possible of collagen. But the problem of collagen is there could be cross contamination because the collagen is obtained from bovine. So there could be bovine related diseases which may get transmitted to the human. So that is one worry about using collagen in large scale. Then comes gelatin. this is found from collagen. It is a denatured collagen obtained by the controlled hydrolysis of collagen, which is extracted from animal tissues. So, obviously gelatin is much more safer than collagen, because you do a chemical transformation hydrolysis reaction. Okay, so they are really linear in nature, unlike collagen. Collagen is a triple helix. So, the linear mixture of polypeptides, because you are doing a hydrolysis, disperse according to size and chemical reactivity. So, we can have polypeptides of different chain lengths. Okay. The properties depend on collagen from which the gelatin is extracted and the method of conversion, whether I am hydrolyzing with acid, base or enzymatic. So, this is a typical structure, linear structure of gelatin. Okay. It exhibits amphoteric behavior due to the presence of both acidic functional groups as well as due to the presence of basic functional groups. Okay. As you can see, it contains both acidic functional groups, okay, C double bond O, as well as the OH. Okay. So, it has both the properties. So, we can encapsulate anionic or cationic type of drugs, molecules, ions and so on actually. So, it is cheap and readily available, very good biocompatibility, biodegradable, less antigenic than collagen, contains abundant RGD motifs. As you know, RGD is a very important peptide sequence which helps in cell proliferation. Cells are able to identify itself. Diverse and accessible functional groups allows for chemical modification. You can see so many different functional groups, so many different functional groups. So, we can do lot of chemical modification of gelatin, support cell adhesion without compromising the cell phenotypes. What are the disadvantages? Risk of carrying harmful agents like bovine, okay, related toxicity, heterogeneous mixture of different sized proteins with wide range of molecular weights. Because I am doing hydrolysis of the collagen, so we can have polypeptides of different chain lengths, different molecular weights. So, that is a disadvantage. So, properties will be more of average rather than singular. So, applications, plasma expander. So, gelofusine 4% weight by volume solution of succinylated gelatin. So, it is used as intravenous colloid. It behaves like blood filled with albumins, increase in blood volume, blood flow, cardiac output and oxygen transportation. So, we can inject gelatin into that. Of course, as you know, gelatin is widely used in food flavoring industries, confectionaries and so on. Wound dressing, gel foam dressing. So, it expands, takes up a lot of volume. It is used in fresh open wounds to stop bleeding. Tissue adhesive, highly elastic and adhesive. So, we can close surgical skin incision by applying this gelatin. Drug delivery, used for delivery of both hydrophilic and hydrophobic anti-cancer drugs. Sustained release, as I said, it has got both acid and basic functional groups. So, we can have cationic or anionic drugs encapsulated with that. Increased targeting efficiency and minimum toxicity. Rapid uptake and long term retention by gelatin nanoparticles after administration. And tissue engineering scaffolds, we can make scaffolds for growth of different types of tissues. Okay. It can support growth of HepG2 cells, spontaneous formation of functional hepatocellular aggregates. Okay. So, a lot of applications. Next comes silk. Silk, as you know, is used quite a lot in fabric. Of course, it can even be made into biomaterials. It has got very good mechanical properties, tensile properties. Okay. So, obviously, silk can have very good application in biomedical applications. Okay. So, it is a protein polymers that are spun into fibers by Lepidopetra larvae such as silkworms, spiders, scorpions, mites and flies. Okay. It is a fibrous protein synthesized in specialized epithelial cells that line glands in this organism. So, obviously, it contains sericin and fibroin. This fibroin is the central, sericin is the sticky material surrounding it. the fibrin contains amino acids like glycine, serine, glycine, alanine, glycine, alanine, as you can see here, and forms the beta pleat keratin. So, it contains fibrin, that is in the central, and then it contains sericin, which is the sticky material surrounding it. Okay. So, silk has got very good mechanical properties, highly biocompatible, it can help in tissue growth and also as a cell scaffold. Provides structural role in cocoon formation, nest building, traps, web formation, egg protection obviously, produced by silkworm silk and spider silk. Biocompatibility, biodegradability, self assembly, mechanical stability, controllable structure and morphology. So, that is the advantage of this silk. So, cosmetics used due to their glossy, flexible, elastic coating power, easy spreading and adhesion characters, release from sunburns. The crystalline structure reflects UV radiation, protective buffer between skin and environment, lower micron silk powder added with hair and massage oils, finer grade silk powder, ingredient of liquid cosmetic preparation, can be used for wound dressing, burn patients, silk protein derivatives, ceratopeptidase used as anti-inflammatory, anti-tumefacient for treating acute sinusitis, tonsillectomy, oral surgery, tooth filling, cleaning, extractions and so on, and also surgical sutures. Like I mentioned, it has got very good tensile properties, it does not cause inflammatory reactions, absorbed after wound healing. So, it is bioresorbed. So, it can find very good applications as surgical sutures. Biodegradable microtubes for repair of blood vessels, molded inserts for bone, cartilage and teeth reconstruction, drug delivery ability to form hydrogels in situ, attractive candidates for localized controlled delivery of therapeutic agents, ability to incorporate drugs at room temperature without the use of toxic solvents, delivery of protein or DNA based therapy. So, silk can find application in wound dressing, surgical sutures, biodegradable applications, drug delivery systems and so on. Then comes fibrin. What is this fibrin? This is a fibrinogen. This is the soluble plasma protein converted to polymeric fibrin. So, fibrinogen, which is the soluble plasma protein, converts to fibrin, which is a blood clot, especially when there is damage to the vascular system. I talked long time back, the fibrinogen is converted to fibrin, forms the clot and closes the gap, prevents the blood oozing out. So, this is a fibrous non-globular protein. So, this fibrin together with platelets form hemostatic plug or clot over a wound site. So, applications. So, fibrin sealant, most effective tissue adhesive, obviously it is produced by the body. So, if you can use it as a biomaterial for sealing tissue repairs, then nothing like it. Formulation of fibrinogen and thrombin at very high amounts combined with calcium and FX3, used as adjunct to hemostasis in patients undergoing surgery, enhances healing, minimizes scarring. Okay. So, a lot of applications. Scaffold has sites for cellular binding, accelerates tissue regeneration, no inflammatory reactions. So, it is very good applications, especially as a sealant, prevents the blood flow during surgery processes, it does not lead to any inflammatory reactions, accelerates tissue regeneration. Okay. So, lot of proteins which are natural, which can be used for tissue regeneration, tissue engineering applications, okay, as a sealant and as a vascular bioresorbable material. Okay. So, we looked at biopolymers, two types of biopolymers. One is the saccharide based polysaccharides, the other is protein based. That means they have this peptide bond, and protein based are widely found in animals and natural environment. Okay. So, they also have very good applications in biomedical area. Okay. Now, we will look at something different. They are called the hydrogels. hydrogels, as the name imply, can absorb a lot of water, and they are polymeric material which swells in the presence of water. So, they can be used in areas of wound dressing, slow drug release, and so on. For example, look at this picture. This is a polymeric hydrogel made up of cyclic beta glucan and carrageenan. When it is in the dry state, as soon as we add water, as you can see, it really swells, expands, and reaches a very soft appearance, very highly hydrophilic, wet. So, they can find application especially in open wounds. So, they are 3D network of polymeric chains that are cross linked by chemical or physical bonding. We will look at what type of chemical or what type of physical bonding that are happening in hydrogels. Okay. They absorb and retain large amount of water, at least minimum 10% by weight or volume. In fact, they can go up to 40, 50, 60, 70%, when 100%. Okay. There are many hydrogels which can retain its own weight. They are created by hydrophilic groups, domains present upon hydration in aqueous environment. Okay. So, they are permeable, viscoelastic, lubricious, hydrophilic, chemically diverse, environmentally sensitive, allow solute transport, multifunctional. So, we can use it for wound dressing, for drug encapsulation, drug delivery, so many applications. Disadvantages, of course, poor mechanical properties, difficult to handle. Sterilization, how do we sterilize this hydrogel? That is a big issue that needs to be thought of more in detail. So, two types of hydrogels, they are classified into two different categories: permanent chemical hydrogel, reversible physical hydrogel. Okay. So, the physical interactions create this type of hydrogel. So, obviously, when the water is removed, they come back to its original dry state. Permanent, that is a chemical reaction takes place. So, obviously, we cannot reverse this. So, there is a covalently cross linked networks. Equilibrium swelling state depends on the polymer water interaction parameter and cross link density. So, the amount of water that can be taken up by these hydrogels depend upon what is the cross link density. Now, if you look at the reversible hydrogel or the physical hydrogel, the networks held together by molecular entanglements, secondary forces such as ionic, hydrogen bonding or hydrophobic interactions, we call them as non-bonded interactions. So, dissolution is prevented by these forces. So, these are reversible, can be disrupted by changes in physical conditions or stress. Okay. So, we can bring it back to its old form, and so with these have some advantages over these in many situations. Okay. You look at each one of them. Physical, chemical, I said. So, the physical, we can have strong and weak types of bonds. Weak could be hydrogen bonds, ionic bonds, hydrophobic bonds, agglomeration bonds like xanthan, paint, polymer complexes, matured acacia gum. These are all weak. Strong could be glycine nodules, lamellar microcrystals, double, triple helices, elastomers, block core polymers, gelatin. These are called strong. Now, chemical, as I mentioned before, there is a reaction, chemical reaction, bonds forming. So, there could be a condensation type of reaction, addition type of reaction, cross linking type of reaction. Condensation like polyester gel. Addition could be kinetic growth, okay, polydivinyl benzene, grafting, CMC, that is carboxymethyl cellulose acrylic acid. Cross linking, that is end linking, random cross linking, polydimethoxyl siloxane, cis polyisoprene. So, two types of gels, the physical and chemical. Physical, you can have weak physical forces, strong physical forces. The chemical could be condensation reaction, addition reaction, cross linking reaction. So, this nice table was taken up from this particular reference, hydrogels, methods of preparation, characterization, application with this DOI. Now, the source of hydrogel, it could be natural, it could be synthetic, or a hybrid, that is combination of both. Sorry. it could be non-ionic hydrogels, it could be ionic hydrogels, ampholytic, that means combination of both, zwitterionic hydrogels, depending upon the charge, depending upon how physical or chemical, depending upon the charge. Cross linking, we can have a physical cross linking, we can have a chemical cross linking. Polymeric composition, we can have homopolymers, that means only one monomer is used, copolymers, that means we can have more than one monomer is used, multipolymers, we can have many polymers into this. Applications: wound dressing, cosmetic, implants, dentistry, food, drug delivery, all these are the areas. Of course, as I mentioned before, they have very poor mechanical properties, so obviously they can be used alone in some of these, but have to be used for example in conjunction with a strong synthetic material polymer for implant applications. Okay. So this nice looking table was taken from this particular references called 2-photon polymerization of hydrogels, versatile solutions to fabricate well defined 3D structures with this DOI. It is a review article. So there is water inside this hydrogel. So there are 3 types of water present in the hydrogel, very interesting, right. The free water, that is water that is not intimately bound to the polymer, this is almost like the bulk water present outside the hydrogel, okay, or pure water. Okay. So it behaves like the normal water that is present outside, so it undergoes thermal transition at temperature analogous to bulk water, say like 0 degrees. Then we have freezing bound water, that is water that is weakly bound to the polymer chain and undergoes a thermal phase transition at a temperature lower than this free water, okay. It is called a freezing bound water. Then we have non-freezing bound water, that is completely bound, it is not like bulk water, or it will not freeze like weakly bound water, okay. This is very tightly bound to the polymer, which does not exhibit a first order transition or the temperature range from this to this, okay. This non-freezing water, that means that water will not freeze when you bring it down to 0 degrees centigrade, okay. So we have 3 types of water: free water, which is almost like the water that is present in the bulk outside. Then we have the freezing bound water, the water that is weakly bound to the polymer, so it will not behave like a pure water or the bulk water, but it will have some temperature transition which will be lower than this. And then we have the bound non-freezing water, which is very strongly bound, it will not undergo any phase transition at these conditions like water to ice and so on actually, okay. So 3 types of water, and these 3 types of water could be nicely observed using a differential scanning colorimeter, okay. So if you look at this, for example, as a function of temperature, exothermic, so we can have this as the, okay, the free water, this as the freezing bound water, and this could be the non-freezing bound water, third time, okay. This is the free water, which is the like a bulk water, this is the freezing bound water, this is the non-freezing bound water, okay. So we will continue on this hydrogel in the next class also. Thank you very much for your time.